Happy holidays, everyone. I'm so sorry it's been quite a while since I've actually come and done any of these. Um, things are things are going on for all of us, and so it's gotten a little hectic. So anyway, you know what? Today, with the holidays, yesterday I was live with Natural Awakenings magazine, Tulsa or Oklahoma, and we were talking about, holiday foods and pancreas and eating carbs and sugars and stuff. So we'll kind of do a little more of this is talk about the liver. So our livers are like these underrated guys. They do a yeoman's job. It's quite amazing how many jobs the liver does. I'm going to name a few in just a few minutes, but let's first talk about, or let me show you where the liver is. I'm hoping you can see on this picture. I have not got the facility on how to do slides. So here is our body, and here is your liver. The bulk of the liver has two lobes, and the bulk of the liver is actually on the right lower rib cage. So it extends just a little bit underneath the rib cage, but fills the rib cage just underneath your respiratory diaphragm. Most of it, front to back, is on the right side. We have a small lobe here that's actually on the left side and only goes halfway across the rib cage on the left side. So you have your liver is mostly on your right side. So, and as I'll show you a picture of the liver, here is the liver. So this is that right lobe here that's on the right side. Here is a ligament that's in between the lobes, and here is the left lobe, which is much smaller. You can see it from behind here. Here is the left lobe, here is the right lobe, and you can see the little gallbladder peeking out from underneath. This is what the gallbladder looks like from behind, okay, from behind here. So we have a little place here that the gallbladder, that the common bile duct is coming to go to the gallbladder. So let's talk a little bit about the liver and how it does so many jobs. It is like so amazing. I actually have a list of several things, so I thought I might, if you bear with me, I might go ahead and I might read this. So it's involved in all metabolic processes in the body. So that says a lot, doesn't it? That our livers are doing so many, that it's involved in all the processes of the body. It converts the nutrients in your diet into something that the body can use or store. It stores nutrients so that you can have it come out, or the liver will like supply it to the cells when needed. It uptakes toxic substances and converts them into something harmless or makes sure that they're released from the body. So let me say a little something right here about this, okay? So the liver does some phases of detoxing. So we know, because we've heard, hey, I should do a liver detox. The liver definitely has two phases of detox that it does. And here is the deal that's going on these days, is that we are genetically getting weaker with each generation. And what's happening is, in specific to the liver, is that many people's livers don't actually detox. It's why I, as a practitioner, and I am not a naturopath, and I am not a nutritionist, and I've just been doing this a really long time, but I rarely ever tell a client to go ahead and do a liver detox. That's not what I recommend, because we don't know if your liver does a good job of detoxing. If we start actually getting you to say you were to start to do a detox and you can't get it out of your body, so your liver is now involved in it's trying to get rid of, or it's metabolizing and trying to get rid of some stuff, but what will happen is that you'll actually get sicker. I know that sometimes you get sick when you do a detox, but you'll get the kind of sick because the toxicity can actually not get out of your body. So I hesitate to tell people to do detoxes. You got to do some good cleaning up and see if the liver can function. Okay. It makes proteins. So what it does is it starts to convert your proteins into something that you can actually use. And it makes triglycerides out of your foods. It makes cholesterol. So let's talk about cholesterol for a moment or two. You know, I have a really different view of cholesterol, or I have a view that there's probably other people that share, is that, let me tell you this, you need cholesterol. Your brain is 75% cholesterol. Your brain is 75% fats. So there's a whole deal. It's like I understand this one little slice that, and I don't know how many other slices I don't actually know about. But here's the deal. So we get cholesterol starting to plaque in our arteries, right? And so here's the question. Why is it doing that? It's it's not just like, oh, okay, cholesterol decides to plaque my arteries. There's a reason for it. Now, one of the reasons is I've been told or have come to understand, this is one example, is that if you're too acidic in your blood, which is really, really common, is a lot of people are too acidic, then what will happen is the body needs to like protect the artery walls. So what it'll do is put some cholesterol in there. So, you know, this idea that we need to reduce our cholesterol, what we need to do in order to do that is to find what is the underlying cause here, what's the underlying note of why it is that my body is producing more cholesterol or my cholesterol is so high. I know that there are some people that have a genetic predisposition in that, and all of that should be found out actually medically to know if that's why you have it or if you're having it for some other reason. You know, I'm a really, really big proponent of finding out what is the core issue of why something's happening and not just looking at the symptomological part that then I react to that. So, you know, taking a drug that's actually going to reduce your cholesterol is actually I'm just saying this, it can give you where you have more dementia, more Alzheimer's happening. So, okay, guys, it synthesizes your glycogens. It makes bile. Now, that bile is going to get stored in that gallbladder. And that bile is so that when you eat fats, your bile goes in to help break down the fats as it's going through the small intestines. You have it works with vitamin K to make the blood clotting factors. Okay? It breaks down old or damaged blood cells. It cleans bacteria from the blood. It metabolizes fat. It processes steroids and vitamin D. And you know what? I bet there's a dozen other things that I'm not even saying, but do you get the idea that your liver really, really, really has this unbelievable amount of jobs? I read this book about the liver that also said that for every category, say, you know, making and storing, you know, breaking down and storing glycogen, there's like 1,000 small things that the liver's doing in each of those categories. So it, you know, I've heard that your liver's doing up to as much as 2,000 different processes. So that's pretty like amazing. I mean, that's incredibly amazing. So from our standpoint, from the bodywork standpoint, what is it, what are common symptoms that will actually tell you, wow, I need to look at my liver, okay? A lot of symptoms, some of the symptoms can be this, is headaches. So headaches can come from a liver that's congested. You can have sensitive eyes from liver congestion, heightened allergies. Okay, I'll stop saying liver congestion. I'll just stop saying that. Heightened allergies, aching in your joints, feeling bloated, the pain patterns that can come from liver are pain in my right shoulder and right neck, pain inside my right hip. It can also actually make my right hip have a long leg, where because it will pull on the ilium, the hip bone, and actually create a long leg in there. What else does it do? Okay. Because here's one of the deals is that So you have these 5 different detox organ or sort of pathways. The liver is one, the lungs are another, the kidney and of course bladder, urinary bladder is one another. Uh, uh-oh, I just ran out of thing. Oh, your intestines. Hello. That's how you get it out. Your intestines and your skin. So if my liver is not able to do its detox processes, then what happens is directly it actually will send things to the kidneys. So there it's like we don't want to get the kidneys, we don't want to ask the kidneys to actually do more than they are supposed to do because kidneys are having their own hard enough time, right? You can also get it coming out through your skin and stuff. One thing I didn't say, and I really want to say because the skin issue, is that your liver is involved in making hormones. Your liver is involved in making lymphatic fluid. So, it is really involved in so many of the different types of processes, as I said in the beginning, all those metabolic processes. So, you can have pain systemically, meaning that all my joints really ache. That can be liver as well. So, do you get the idea that you really want to help your liver? So, in the circles of teaching visceral manipulation and stuff, we call the liver a bag of blood because so much of your blood is going through your liver, right? To be clean, to be, all of the things that I've mentioned. So, it's like a bag of blood. So, what can I do to really help my liver some? One thing is, and this is a long-standing thing, is that you can have a warm lemon water, big glass of warm lemon water, first thing in the morning, before you eat, before you brush your teeth, before you do anything else. You have this warm lemon water, and it goes down and sort of says to your liver, "Okay, liver, we're going to start our day this way." You kind of set the liver up for starting the day well. The other things that I really believe that you can do for your liver is eat more vegetables, guys, and eat vegetables in the whole rainbow. But for blood in particular, it's dark leafy greens or bitter greens are really, really good for your blood. So therefore, it's going to be really good for your liver as well, unless you have some issue that you cannot do those, that greens. So anyway, that's what I have to say about the liver today. I appreciate you guys joining me and anybody who's watched it after. And have happy, happy holidays and stay safe.